Cervical disc replacement or cervical disc arthroplasty is the removal of the cervical disc and placement of an artificial disc within that segment. So someone who is a candidate for a cervical disc replacement will be a patient who have had a disc herniation or cervical stenosis from arthritis that's causing compression on the nerve root or the spinal cord. And that's typically the ideal candidate for that particular procedure. The technique that we use is typically a left or right-sided approach to the cervical spine. Once we get exposure, we remove the disc using a combination of curettes and kerosene. And then we use a burr to square the end plates. Then we size the disc using the manufacturer's disc replacement techniques. And then the appropriate disc size is placed for that particular patient within that segment. After the surgery, what a patient can expect is that within the first 1 to 2 hours after surgery, they may have a little bit difficulty swallowing, and that usually is self-limiting. It's resolved. If it continues longer than that, they will receive steroids to help quiet that irritation down. And within a week of surgery, we expect that the symptoms should be completely resolved in about 98% of patients. And in 3 to 4 weeks after surgery, most of the patients return to normal activity.